Can brain scans show differences in an ADHD brain and a non-ADHD brain? They sure can. Check out part 1. In this part, I'm going to explain what those brain differences are. Of course, when I asked AI for a brain image of ADHD, it was a male. So I've asked for a female image. The first difference is smaller brain volume. Studies show that ADHD brains have slightly smaller brain volume, particularly in areas associated with impulse control, attention, and executive function. The prefrontal cortex, amygdala, and hippocampus may develop more slowly in ADHD brains. The prefrontal cortex is this part of your brain, and this is responsible for decision making, judgment, focus, and impulse control. In ADHD, this tends to be less active, which is why people with ADHD struggle to control their impulsive urges. 3 is dopamine and neurotransmitter differences. fMRI and PET scans show lower levels of dopamine in the ADHD brain, but this is where medications such as Ritalin or Vyvanse come in to help with those dopamine levels. 4, connectivity differences. Brain networks responsible for attention, reward processing, and executive function are less connected or less active in the ADHD brain. Whilst there are clear patterns, we need to remember that a brain scan won't tell you everything about your brain. You do need to undergo an assessment and a clinical interview, because a lot of ADHD is based on behavioural symptoms as well. Got a question on psychology? Drop it in the comments.